The motherhood is one where all the love begins, and nothing can complement motherhood like breastfeeding. Breastfeeding is an unsentimental metaphor for how love works in a way. You don't decide how much and how deeply to love. You respond to the beloved and give with joy exactly as much as they want. A very good afternoon, dear ladies and gentlemen, on this virtual platform. Department of Obstetrics and Gynecological Nursing, along with MSc Nursing students of Lakshmi Memorial College of Nursing, are glad to conduct a webinar to observe World Breastfeeding Week 2021. I, Mrs. Soumya Sebastian, first year MSc Nursing student, privileged to welcome all of you to this webinar. World Breastfeeding Week is an annual celebration which is held every year from August 1st to 7th in more than 120 countries to encourage breastfeeding and improve the health of babies around the world. Breastfeeding is the best way to provide infants with the nutrients they need. World Health Organization recommends exclusive breastfeeding starting within 1 hour after birth until a baby is 6 months old. This year, we are observing World Breastfeeding Week with the theme Protect Breastfeeding, a Shared Responsibility. Is about how breastfeeding contributes to the survival, health, and well being of all. Prayer is not asking, prayer is putting oneself in the hands of God. Let's invoke God's presence and blessings for the success of this program. I request Ms. Rachel, third year BSc Nursing, to lead us into prayer.
पिता तुम्ही हो बंधु सखा तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो साथी तुम्ही सहारे कोई ना अपना सिवा तुम्हारे तुम्ही हो नैया तुम्ही सखा तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो जो खिल सके ना वो फूल हम हैं तुम्हारे चरणों के धूल हम हैं दया की दृष्टि सदा ही रखना तुम्ही हो बंधु सखा तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो.
It is said that smile is an universal welcome, but words are the channel of welcome. It's my pleasure to start this auspicious occasion by extending a warm welcome to you all. First and foremost, I would like to welcome our respected resource persons of the day, Dr. Sharon Deepthi Rasquina, consultant obstetrician and gynecologist, Unity Hospital, Mangalore, and Sister Danya Devasya, professor and HOD, OBG Nursing, Father Muller College of Nursing, Mangalore. Your presence gives us a bliss and increase our thirst for knowledge. A warm welcome to you both. Leaders become great not because of their power, but because of their ability to empower others. I would like to welcome our great leader, respected principal, Dr. Larissa Martha Sams, Lakshmi Amar College of Nursing, whose vision, inspiration, and leadership has helped in great success of this institution. I welcome you, madam. I extend my hearty welcome to our beloved Vice Principal, Dr. Teresa Leonilda Mendonça, Lakshmi Memorial College of Nursing. Anything is possible when you have a right person to support you. It's my turn to extend a gracious welcome to Mrs. Sandhya D. Almeida, Professor and HOD of OBG Nursing, Lakshmi Memorial College of Nursing. I welcome you, dear madam. A cheerful welcome to participants of various colleges who are present for today's webinar. A hearty welcome to all HODs and faculty, organizers, and MSc Nursing students of MSc Nursing. Once again, I welcome you all. Light a lamp to brighten the day. Let the flames lead our way. May I call upon Dr. Larissa Martha Sams, Mrs. Sandhya D. Almeida, Mrs. Kavana E. and Ms. Rekshita to come forward to light the lamp. Thank you all. Breast milk is a liquid gold. It's not only to nourish, but is to bond forever. Breastfeeding week signifies a lot. Here we have Mrs. Kavana E., lecturer OBG Nursing, Lakshmi College of Nursing, to unveil the significance of the day.
Good afternoon to all. The World Breastfeeding Week is organized every year by the World Alliance of Breastfeeding Action. It's a global campaign that is celebrated every year during the first week of August that aims to protect, promote, and support breastfeeding around the world. In 1992, the first World Breastfeeding Week was celebrated. The theme for 2021 is Protect Breastfeeding, a Shared Responsibility, is about how breastfeeding contributes to the survival, health, and well being of all. Breastfeeding instead is its own language, a language of joy, bonding, growth, and nutrition that is spoken from one body to the another without sound. There is no other substance on the earth like breast milk. Breast milk provides every child with the best possible start in life. It delivers health, nutrition, and emotional benefits to both children and mothers. Objectives of World Breastfeeding Week 2021: inform people about the importance of protecting breastfeeding, anchor breastfeeding as a support as a vital public health responsibility, engage with the individuals and organizations for greater impact, galvanize action on protecting breastfeeding to improve public health. Here I conclude, overall breastfeeding has been found to promote a healthier lifestyle for the child and the mother. I feel that everyone should consider the important research that has been done and consider breastfeeding their infants to help to decrease the risk of certain illness their child may come about in the near future. Thank you.
Thank you, Kavana, for enlightening us on significance of the day. True guidance is like a small torch in a dark forest. It does not show everything at once, but give enough light for the next step to be safe. Our dream of organizing this webinar has become reality by constant encouragement and support by our respected principal, Dr. Larissa Martha Sams. Madam, we are waiting to get inspired by your words.
Good afternoon to one and all. This week is observed as a World Breastfeeding Week, where most of the institutions and all the healthcare setup take a time to observe this week, highlighting the importance of the breastfeeding in the growth of the child. So, in this regard, Lakshmi Memorial College of Nursing thought it is apt that we invite the resource persons to give the essence of this week by their valuable experiences and valuable talks. So I wish each and every delegate a very best and all the best to each of the participants who have gathered here. So after the deliberations, I think we will be in a better positions to highlight the importance of the breastfeeding and also use that experiences in taking care of the children and especially the mothers, educating them so that India can become a robust country by adopting the breastfeeding methods to their infants. I wish each and everyone once again all the best. Have a fruitful session. Thank you.
Thank you, madam, for your inspiring words. Before we head on to the sessions, participants kindly note the instructions. Please mute your audio during the session. If you have any queries, you can put it in the chat box and it will be clarified at the end of each session. Feedback link will be provided in the chat box during the session. E-certificates will be sent to participants who attending the webinar on both the days. It's the time to begin with our first session. Antenatal examination and care is essential for protecting the health of women and their unborn children. If breastfeeding is so natural, Why can it be so hard to do? Because while a mom plans to breastfeed, she doesn't often prepare for breastfeeding. To increase your chances of being satisfied and happy with your breastfeeding experiences, you will want to do some essential things to prepare for breastfeeding while you are pregnant. Who can be more knowledgeable than an experienced obstetrician and gynecologist about the topic antenatal examination and breastfeeding preparation? Yes, dear delegates, we have Dr. Sharon Dipti Rasquina. Doctor has done her MBBS from K.S. Hegde Medical Academy, Derlakate, MS at Yenapoya University, diploma in laparoscopic surgery from Germany, and she is a trained infertility specialist from Singapore. She has presented various papers during state and international conferences and has the credit of several publications in national and international journals. She was a faculty at Yuva KSOGA Mangalore and delivered a talk on intrauterine infertility in 2017 and also given a talk on teratogens in pregnancy in All India OBG conference held at Bangalore in 2018. Presently, she is working as a professor, OBG, Kanachur Institute of Medical Science, Darlakate, and consultant obstetrician and gynecologist, Unity Hospital, Mangalore. We are honored to have you, madam. Over to you.
Thank you. Am I audible? Okay,
Audible.
fine. Yeah, I think I'm audible. So I'll just start. The breastfeeding preparation, or this is called the breastfeeding week. So the breastfeeding is an important part, or is an important event in a mother's life, just like how she is planning her pregnancy or during her antenatal period. So the preparation for the breastfeeding should start when she plans, so before she plans her pregnancy. So let's see why the preparation is important. So first, I'll just talk about antenatal examination, what we require to know in breastfeeding pertaining to the feeding. So first is, what is this preconceptional counseling, isn't it? So most of our pregnancies in our country are not planned, or rather unplanned pregnancies. They come to us only when they miss their periods, maybe after 2 or 3 months, and by the time they're already finished the initial crucial phase, so they're already in the third month. But slowly we're seeing that changing in the trend because of the newer generation we see, because of the late marriages. Now the new generation are actually planning pregnancy. So they come and meet the gynecologist to ask what are the tests, or what should I do to have a good pregnancy. So that is a good approach that we are seeing these days from a very few sect. Maybe our country may see a little bit improvement, in the coming years. So what exactly is this preconceptional counseling? So preconception is before a couple plans to have a baby, they should visit a gynecologist to know what are the risk factors. Are they carrying any hereditary diseases or any other diseases pertaining to this? So that, it can be corrected before she plans for pregnancy, and there can be a better pregnancy outcome. Okay, like for example, if there are underlying infections or underlying diabetes which is not treated, it will end up in a preterm labor before her date. That will end up in what? Preterm baby, small baby, she'll not be able to breastfeed. So it's like a vicious cycle. So that has to be taken care even before she plans for pregnancy. And that is what we call a preconceptional counseling or a preconceptional care. Now, what are the things, or what are the goals of this? So first, in this, before she plans for pregnancy, you need to ask her medical history of diabetes, hypertension, or whether she has undergone any previous surgery, or if it's a second pregnancy. In the previous pregnancy, how was it? Was she finding it difficult to deliver? Was it a cesarean? Was she finding it difficult to breastfeed the baby? Was there any deficiency in the breastfeeding? Her personal history as to her diet, or any take of alcohol, smoking, is very important these days. Again, family history of diabetes, hypertension. And now coming to this physical examination, which is a must. Now, when I talk about physical examination, which also includes breast examination even before she plans her pregnancy. So one is to look for any lump, because breast lumps are again seen very young age. You don't have to wait for an older age. You can see breast lumps at an early age. So one is examining for that. Second, to see for any retracted nipples. So that is one of the common things that see a young girl or before her marriage, she wouldn't recognize the retracted nipple. It's only this problem she faces only once she starts breastfeeding. So by the time she starts or plans to breastfeed and you correct it, it becomes late. So it's better to catch it early. So if you have any retracted nipple, I will show you in the coming slides how to correct a retracted nipple. And then you have laboratory screening like diabetes, hypertension, HIV, HbA1c, and that's like a routine thing. Then in your preconception counseling, doctor will definitely advise folic acid tablets. That is a pre-conceptional nutritional or this one tablet that is given to every pregnant woman. Preferably, it should be taken 1 month prior to you planning pregnancy. Because here, like I told you, many of them come after the pregnancy UPT is positive, then we start on later, but preferably started 1 month prior to planning pregnancy. But if the patient is on some antipsychotic drugs or antidepressants or anti-epileptic drugs or something like that, then these people should visit the gynecologist much earlier and start the folic acid tablet at least 3 months prior to she plans her pregnancy. Okay, even obese women also need to consult a doctor because she can help. They can help to tell how much to lose weight. Her sugars can be controlled. She can be given folic acid because again, obesity is one of the risk factors for reduced supply of breast milk. Again, coming to vaccination, definitely vaccination is an important entity. Hepatitis, ask whether she has taken an hepatitis B vaccine prior to pregnancy. If not, give rubella vaccine. Rubella vaccine is a very important thing. Most of the times, these days, these generation, I think kids would have all taken rubella vaccine because it comes under the government vaccination schedule. So most of the kids would have taken, but the ones who are a little older, maybe if they wouldn't have taken the rubella vaccine, it is better to do the rubella test and see whether they are rubella positive. If not, better to give a rubella vaccine because rubella causes a lot of disorders in pregnancy. And at present, the present one, the COVID vaccine, which is definitely important. If you're planning for pregnancy, take your vaccine, then plan. But it's okay if you're already pregnant and you're this one, no harm in taking because the Ministry of Health has given an approval for our country in the last 1 month that we can give vaccine even for the pregnant women and lactating women, even if you're breastfeeding. Next, like I told you, screening for all the diseases. Now, for example, I'll just give you, like if an urinary tract infection or anemia, urinary tract infection which is not corrected in pregnancy, if it's not treated in pregnancy and anemia is not corrected, if a hemoglobin is low, pertaining, she continues her pregnancy. This will definitely end up in a preterm labor. So when it enters in a preterm labor, obviously the lady would not be able to produce the amount of milk that she would have produced as she had delivered in a full-term baby. So that definitely affects the breastfeeding. So treating all the infections prior to it, any sexually transmitted disease or any vaginal infections, anything should be treated well or well in advance. Like I told you, again, insisting on smoking and alcohol abuse. Smoking will definitely reduce your breast milk production. Alcohol, again, alcohol intake for a long period of time or taking excessive intake of alcohol definitely will reduce your breast milk production. Again, I have patients coming and asking, can I take a little bit of wine for the weekend or a little bit, small 30 ml? The answer is a no, a big no. So in pregnancy, we definitely do not recommend to take any form of alcohol, even if it is 2%, 5% or whatever, even if the wine contains less amount, we do not recommend to take alcohol because alcohol definitely goes directly, it crosses the placenta, enters the blood-brain barrier of the baby and affects the baby. And definitely in the long term, in the long run, it reduces your breast milk. The baby is not fed properly. The baby is cranky, and again it continues. So this is just a picture to show you about how alcohol baby whose mother who's consumed alcohol will have microcephaly, will have mental retardation, will have other renal abnormalities, growth restriction, and definitely reduced normal intelligence. Now, just going to antenatal care or antenatal examination, why this is important. Okay, it is a care of a pregnant woman with the aim of achieving a healthy pregnancy and the delivery of a healthy baby. So the ultimate goal of us is all to deliver a healthy baby. So why for that to have a healthy baby, to have a healthy mother, you need to have a good antenatal checkups. Okay. So why you need to have proper antenatal checkups is like I told you, you should need to have so that they give proper idea about how to go about the pregnancy, what to do in each trimester, what tests to be done, what nutrition to eat, what exactly to eat and what to avoid, what medicines to avoid. So this is a part of the your normal antenatal care. So the final objective, an objective of a gynecologist is finally to give a healthy baby and a healthy mother. So whatever the problem is, our outcome should be a healthy baby and a healthy mother. End of it. So first, I'll just go through a little bit of examination. So history taking, like I told you, ask about any history, whatever she has, any particular diseases or any family history of any particular diseases. And every visit she has to undergo blood pressure checkup, weight gain. Weight gain is very important because if there is no adequate weight gain, also that means there is no enough nutrition she's lacking, which again should be emphasized. Or if there is an overweight, then you should think of some other like hypertension or some other diseases. So that should be kept in mind. So the weight checking, proper blood pressure examination, examining the chest and everything, breast examination. A breast examination at the first antenatal visit when she comes to you should be examined. You should tell her because there'll be breast tenderness, there'll be breast pain in the initial first 3 months or first 4 months of pregnancy. So that should be explained to the patient saying that it is normal to have this pain and see for any retracted nipple, see the nipple size. If there is no retracted, if there is a nipple is retracted and it's inside, we'll have to teach them how to do a normal slowly massaging of the nipples and bringing it out so that she can prepare herself for the future or breastfeeding in another few months. Okay. Examination is like I told you, examination from 12 weeks where you will not feel the uterus. Only after 12 weeks you feel the uterus in the abdomen. Then you have 16 weeks, around 24 weeks you'll feel it around the umbilicus. 28 weeks little above, 36 weeks just below the symphysis pubis. And at 40 weeks it comes down because your head is going in. Okay, these are the normal examinations which you are supposed to do in every pregnancy. And these are the common symptomatology in pregnancy like nausea, vomiting, backache, hemorrhoids, vaginal discharge, heartburn. These are all normal things which every woman, if not one or if not two, something or the other she will end up having because we are supposed to tell them these are all common symptoms which are supposed to be there in pregnancy. Okay, now weight gain. Weight gain is an important entity again. Weight, yes. Most of the people think that pregnant women can put on weight. She can afford to eat anything because she's eating for two. That is a wrong notion. There is nothing called eating for two. You have to have a restricted, proper, good, nutritious diet. Okay, earlier it was said that you need to put on 11 to 12 to 14 kgs of weight. It's not a problem. No, it's not so. It all depends upon the your BMI. If you are an moderate person who is a little okay person, and if you're become pregnant, then yes, you can put on around 10 kgs of weight. But if you are little overweight, then you cannot afford to put 10 to 12 kgs of weight, maybe around 8 to 9 kgs of weight. A little obese person can only put on around 5 to 6 kgs, which means it's only her baby weight, amniotic fluid, placenta, and little bit of weight gain, which she has to control. Okay, because all this weight gain and weight thing will definitely affect the breast milk production later. So then again, rest and sleep is a very important entity which has to emphasize. Now there are all most of the women are working. I don't think they'll get enough rest in the afternoon, but at least proper adequate rest in the night is important because stress levels will definitely reduce your breast milk production. So you have to be emphasized. Proper activity, exercise is a must, irrespective if you're working or not working. Exercise in the form of like brisk walking or some form of swimming or cycling, or even just jogging, in a little bit of skip jogging in your chosen is definitely a must. Wearing loose fitting clothes, avoiding coitus especially in the first 3 months and in the last trimester, because to avoid unnecessary bleeding or any infections. Care of the breast. Care of the breast should be emphasized in every time a patient comes to you. Care of the breast, which I mean again, that she should properly wash it, have bath, wear proper loose fitting clothes, and take care of the breast. There is no need of using any particular chemicals or any washes or that are pregnant and all, which causes damage or harm. Proper, normally take care and dry it and keep it. Sometimes even a pregnant woman, like when she's antenatal second or third pregnancy, she can find a little bit of milk oozing out, which is quite common. She has to just take care, maybe rub it or use a breast pad or anything, which is normal. Nothing has to be done. Don't keep on expressing milk before the baby comes out, because then your milk production will increase. So just take care, proper care should be. And before a lady comes to us, even during her antenatal period, she should be told about the benefits of breastfeeding, because these days the newer generation moms are not aware, in the sense they're so worried about getting back to work, or they're going to they're this, so they're not worried about that. So they're more worried about that. So they should be emphasized upon how to take care of, what are the benefits of breastfeeding. They should be asked to form a group with, like, maybe talk to some of their friends and be told about what is the advantages of breastfeeding, why you should do it, how frequently you should do it. So most important, they should be educated even during their antenatal period about the benefits of breastfeeding. Definitely, these are all warning signs which are in pregnancy: unassured bleeding, which comes at any time, headache, blurring of vision, epigastric pain, reduced urine output, you have edema of the leg or edema of the face, or your fetal movements are not adequate, or frequent pain, recurrent urinary infection, or any vaginal infection. These are all warning signals which need to be come into doctor immediately. Okay, ultrasound is, we usually recommend three most important scans. One is the 10 to 14 scan, second trimester, and that is called a growth scan, which is like, it's a must. Like, that these are the three scans. But then, depending on your doctor, we do different scan depending upon your condition and the patient's condition or the need of it. But actually, the most important are these three scans, which is a must. Yes, like I told you, iron tablets, folic acid tablets, it has to be taken prior to pregnancy, preconceptional, because folic acid not only prevents neural tube defects, also to prevent anemia. Well, your folic acid deficiency, anemia is also important. Then you start iron and calcium tablets. Iron tablets is a must, and calcium. Iron is started from the third month, that is from the 13 weeks. You start daily one tablet of iron along with calcium tablets, which both the tablets are not taken together. They're taken at different times, because calcium will inhibit the iron absorption. So there are some people who tend to have the habit of taking both the tablets together. That is not recommended. You have to take iron or calcium tablets separately. Okay. Now, why do you need to take iron tablet? Iron tablet, because in pregnancy, anemia is very common if we do not supplement ourselves with iron. So, patient who is anemic, or the lady who is anemic, will definitely will give birth to a small baby. Her breast milk production also will be, she'll not be able to feed enough. So that is why this iron correction of iron should be done even prior to her, before she delivers the baby. So iron should be given, and calcium, calcium is necessary for the good strong bones. And once she starts feeding, calcium is important, because calcium is the necessity for the baby, because baby did not get any other extra calcium. It's only through the mother. Okay, so like immunization, as I told you, tetanus is safe, which we usually give 2 doses of now we give this as a DD-VAC, this one, tetanus along with the pertussis vaccine. So 2 doses we can give. If she has already taken and one pregnancy, this is a second pregnancy, and a first pregnancy is less than 5 years, then most of the time we just give a booster dose, or we don't give at all. Only if it is beyond 5 years, we give another tetanus dose. And yes, at present, to emphasize again on the COVID vaccine, which is definitely recommended at present now. These are just the tests what you're supposed to do. Hemoglobin again, anemia is important, because anemic patients will definitely have difficulty in feeding the baby. Okay, then HIV, all other infections, because again, underlying infections will again reduce the breastfeeding. Then sugars, yes, a diabetic mother or hypertensive mother will also produce less amount of breast milk. That is why screening of diabetes at that particular GCT, whatever we do, or DIPSI, depending upon your doctor, at 24 to 28 weeks is a must. So if you rule out diabetes and start treating, you can have a better outcome of pregnancy. Okay, these are all the when you do the tests and all those things. How frequently you should go to the doctor is this one. Once you confirm your pregnancy, every month up to 28 weeks. That is just before you enter the 7th month. That is 28 weeks. From 7 to end of 8 months, that is between 28 to 36 weeks, you go once in 2 months, and then weekly till you deliver. But if you are a high risk patient, like if you are an anemic patient, or if you are twins, or if you're carrying twins, or diabetic, or hypertensive, then your doctor will ask to come more frequently depending upon your condition. Okay, now what is the role of a nurse? This is this one from the Ministry of Health of the Government of India. What are the role of nurse in our prenatal care? What is the role? So first is registration, proper health status of the patient to find out, because nurses are the ones who talk or deal with patients more compared to doctors. Doctors just come, we just talk, or maybe they admitted, we just come see for a while. But you're the ones who are more all the time, who are there with the patients. So find out the health status, find out what it is. Like I'm talking about pertaining to obstetrics, find out about their TT taken, tell them about the safe practices of abortion, taking the importance of taking folic acid, why to treat, why anemia, prophylaxis of anemia, why importance of taking anemia, iron tablets is important, to screen for other diseases, how to plan the pregnancy, about the immunization, about the importance of test, and all should be explained very well because that is important. And the most important thing is the antenatal advice about diet. Yeah, because this plays an important part in the breastfeeding or the to form the breast milk, because a diet should be nutritious. It should be a balanced diet, which should be have enough amount of carbohydrate, proteins, and fats. Not only having carbs like eating a lot of rice and no enough proteins. No, because a breast milk should have enough amount of carbs, proteins, and fats, and the enough minerals for the baby. It should be light, easily digestible, not very heavy and oily thing, rich in protein, minerals, and iron and folic acid. Iron is very important. So let's see what are those foods. So these are some of the foods that are say though asparagus and Brussels sprouts and all are not available in our country. Though for us it's a green leafy vegetables, all the form of vegetables that you get, any form of green leafy vegetables that you get, the spinach, the palak that you get, or the methi leaves, they're all very good, rich in iron. The green peas. And for the non-vegetarians, we have meat, the liver meat of any meat, okay, is very good. So that is a very good source of iron. Or dry fruits or anything, they are all good source of iron. So good iron-rich food should be explained to the patients because most of them will not be aware. So we should emphasize on taking a good iron-rich food to have a good nutritious, the end of it, a good breastfeeding mother. Okay, rest and sleep, like I said, rest is very important because if there is no proper adequate rest and if the mother is stressed, definitely it will affect the breast milk production. Okay, so she should not be too stressed in her work and everything. Ask her to lie down properly, supine, not on her tummy. This is the best position. That is left lateral position is the best because it will prevent the hiatovenal compression. Blood flow also becomes less. So this is a better way to rest. But yeah, unknowingly, if she sleeps in the night the straight, that's okay. But whenever she tries to rest, try to ask her to lie down on the left side, left lateral position. Then definitely bowel, asking a good intake of fiber diet like fruits and vegetables because your motion should go very well. Bowel movement should be very well, especially there is a lot of problem during pregnancy. So they should be emphasized on taking plenty of fluids. Now, when I tell fluids, yes, drinking water is a must. Most of them have this myth that after delivery the women are not given water. They say no, the baby will have cold and you cannot drink that, you cannot use this. No, mother should have lots and lots of water because breast milk, your 50 to 60% of your breast milk component is water. So if you don't have water, there will not be enough milk production for the baby. So definitely you need to have around your 10 to 12 glass of water, either in the form of water or milk, 2 glasses of milk, or some form of tender coconut water, whatever with the way you like to have, but it should be in liquid form. Okay. Abstinence, that is avoid sexual intercourse, especially in the first trimester and the last 6 months, because chance of infection, abortion, or preterm delivery are definitely high if done so. Traveling, again, many of them ask about this traveling. I will talk about, I'll just go run about that, saying that in the you can travel by any means except avoiding maybe two-wheeler or a three-wheeler auto rickshaws because they're more bumpy roads. We cannot also. But any other means of transport is quite safe. Even buses, your own vehicles are quite safe for a pregnant woman. Air traveling is very safe. After 32 weeks, definitely air travel. Do not allow women to travel. So any other means of transport for a woman is okay. Then personal hygiene, again, I will emphasize on personal hygiene because proper bath, and because a pregnant woman has more chance of getting fungal, especially under the breast. So because of the sweat and because of the increase in the weight and her diaphragm goes up, there's a lot of chance of getting fungal infection around just below the breast. So she should be advised about proper bath, like especially if it's a summer and all, twice a bath. Change your clothes, wear cotton clothes, loose fitting clothes, proper fitting bra. All these are a must, which should be advised in the antenatal period itself. Definitely, we should educate them about breastfeeding, importance of breastfeeding, emphasize, ask them to form a group. They should be, all the people, all the mothers should be told about why breastfeeding, how it is done, so that she's not taken by shock immediately after the delivery of the baby at house to feed. So she can be asked, now most of them are all gadget friendly. So you can ask them to go and see on the YouTube how to proper feeding, because it's explained well as to how to latch the baby, what should be done, the full breast. So they should be explained well in advance so that they are aware of it immediately. So once immediately after delivery, they get very anxious because it's a new thing for them. The baby starts crying, they are not aware. They also start feeling helpless. So it's better to educate them in the antenatal period itself. Now I'm coming to the main part, and that's what are the things that you can do to prepare yourself before your baby arrives. That is, first is breast and nipple care. That are, like I told you, clean. Whenever she's pregnant, ask her to clean water while having bath to clean it proper. Do not apply any form of extra soaps, as which says which is too good or anything, Dettol and all. Such extra things are not required. Your normal soap, what you have bath, when you have bath, just clean it, the nipple and the areola. Do not use any other chemicals or sprays or anything that says which it cleans or anything. Nothing is required because they are not good. Proper breast massage, maybe you can recommend for women who have had maybe a little difficulty, or those who have delivered early, or some form of difficulty. Maybe you can ask them to do a little bit of breast massage in the last weeks of pregnancy. If they're having an older child who's already breastfeeding and she's now going to deliver, better to stop that child from feeding. Separation from that particular infant is a must if she's planning to properly breastfeed the next baby. Okay, and then proper suitable maternal bras, like I told you, to prevent, do not cause any compression. It shouldn't be too tight, the clothes, then a tight tops with a tight fitting bras, that sports bras, or that wired bras, which definitely will hamper, because of the pain and thing, it will definitely hamper the breast milk production. Okay, now this is what I told you about the importance of retracted nipple. This is very commonly seen in pregnant women. So if we don't notice this antenatally or before she plans for pregnancy, or at least when she in the last trimester of pregnancy, we are going to definitely face a lot of trouble, because and she's going to feel helpless, because the baby will feed on something. There is no nipple. Baby will try to suck, will not get any milk. Baby will start crying. Mother will be anxious. We start feeding top feeds. Baby will nicely feel happy eating top feeds and sleeping. Here, mother's breast will become engorged. She'll start having fever and later end up in breast abscess. So it's like a vicious cycle. So this problem should be seen in the antenatal period. Okay, this is how a normal. This is an orange to show you how a normal nipple and inverted nipple will look. So the best way, what we can do is teach them about syringing. Initially, if before she plans. In the last trimester, maybe you can tell her about just pulling it out with her hand also. Clean the hand properly with soap and water and then pull it out. Okay, you can keep pulling it out. It will come out slowly. But if it's after pregnancy, then you have to do this syringing. This is a normal syringe. You cut the sharp end, you give the negative pressure and pull it back. So that inverted nipple will be pulled out. So this method should be followed to all the pregnant women who are having retracted nipple. If retracted nipple is not corrected, like I told you, baby will start crying, there won't be enough feed, and it will be like that. Then later she'll end up having an abscess, breast abscess, because the milk will be there inside, baby would not have fed, it'll end up in a problem. Okay. So this is how a proper protruding nipple should look, not a flat nipple, a small, but the size varies from women to women. But whatever, it should be a protruding nipple. When you see from here, you should see the nipple separately from the areola. Okay, now what are the foods that help to increase a breast milk, which should be started even when she is pregnant? Definitely, we recommend all these eggs, which are good in all foliage and iron, calcium, everything, almonds, all sort of dry foods, basically almonds, fish, salmons, fruits, citrus fruits, vegetables, carotene, because carrots contain good carotene, brown rice because of its husk, it contains vitamin B1 complex, oatmeal. Oats are good in fibers because it helps in relieve her of constipation, and a good source of calcium too. Oil, coconut oil. They specifically mentioned coconut oil because it contains good fats. That's why. Then, like I said, all the form of green leafy vegetables that you see, and fenugreek. Fenugreek is methi, which I think here all our coastal we know that immediately after delivery we end up stuffing in the pregnant women with methi rice, methi laddu, methi things, everything. But yes, definitely methi is good in in improving the breast milk production. So these are called the top 10 foods or good food. Milk, I want to mention also milk. Even a good milk contains good amount of calcium. So these are the top foods which helps to increase the breast milk supply. Now, what are the 5 ways to avoid stress during pregnancy. Eat and sleep well. Ask them to eat well. Good, nutritious, balanced diet. Avoid unnecessary junk food, oily, spicy, which will cause gastritis and unnecessary. Home cooked, good, nutritious diet, and sleep well, which is very important. Again, I would emphasize sleeping well in pregnancy is important for a good, healthy baby, good pregnancy outcome, and definitely for a good breast milk production. Exercising is a must. There is no thing like the pregnant woman should not work, no going, let her sleep, let her lie down, nothing like that. Even pregnant women should do at least 30 minutes of exercise every day, some form of movement exercise. Meditation, maybe in the form of yoga or anything, or listening to some music or some holy songs or reading some form which helps to soothe your mind, because all this definitely does a lot of impact on your milk production. Doctors ask them to talk to someone who trusts, especially in this present pandemic where all are very sad, upset, we can't go out, we can't do this, cases are increasing, all are so worried and upset. So, like in order to, you can't go out, especially a pregnant woman wouldn't recommend to go out in a crowd or anything like that. So she can call somebody whom she can trust and talk, not somebody who will tell you, oh, now yesterday in Mango we had 400 cases. What is going to happen? We're going into another lockdown, which will further increase her tension and stress. Not somebody like that. Somebody who would ease out her tension, maybe her friends or something like that, could talk something nice. So you can tell her that, so that the stress will be reduced. So not increase the stress as to wait, she'll go for delivery, whether you have to do COVID test and all those things. And don't, definitely not to skip appointments with the doctors. If these things, 5 things are followed, I think most of the things are covered. Okay, you can relieve your stress, or rather reduce the stress. Next, I just want to emphasize on this breast milk, because most of the mothers start complaining immediately after delivery. When I go the next day, they start complaining, or they are what do you call that, who takes care of that baby, they start complaining, no milk, no milk, no milk. See, the milk production is there. Humans, or God has made a human where the milk production is depending upon your baby's requirement. We are not cows where we can produce lots and lots of milk. Our milk production is according to our baby's needs. So day one of the tea, immediately after the delivery, maybe after normal delivery, within 1 hour we give breastfeeding. This cesarean, maybe after 2 to 3 hours, once some mother has come out of the this, we ask them to breastfeed the baby. And rooming in, keep the baby within your room. And the first day, it's only the colostrum that comes out, which is mainly which is very good in immunoglobulins, and which is a must for the baby. It should not be discarded. That only that little amount, even that small 10 ml or 5 ml is sufficient for the baby, because the baby has just started feeding. It doesn't require excess of milk. Now, why do they complain? Because baby is crying. Baby cries for different reasons. A small neonate cries. It cannot speak like you and me. So it will cry. If it's hot, it cries. If it's cold, it cries. If it's tight to tight, it cries. If you bathed in too hot water, it cries. So it cries. That doesn't mean that the baby is hungry all the time. If the baby is peeing, passing urine properly, if you're changing the diapers or you're changing a cloth, and you see the baby's passing motion at least 5 to 6 times a day, that means it is proper. It's proper. The crying doesn't mean that the baby is hungry. You need to feed frequently. That's what, feed frequently. Once, initial days, you need to feed maybe once in 2 to 3 hours, for maybe 10 to 15 minutes. Later, the baby's capacity increases. Even the mother's breast milk production also increases depending upon your baby's needs. It's only in some rare cases only where we really need to give medicines to increase the breast milk, like maybe she's really in pain, she had severe bleeding after delivery, postpartum hemorrhage, or she was under some medication, or some psychiatric mothers where they don't know. In those conditions, yes, we definitely need to give some form of milk. But most of the time, mothers will produce milk, enough milk, what is there. So as she feeds, the milk will start producing. Okay. This is how a good breastfeeding baby will look. Properly, good latch, properly, whole mouth into the, not on the nipple, onto the areola, and cheeks are full like this. And nice, satisfied baby should be fed properly in an upright position. Good position is very important again, because if you are not feeding in a proper position, baby will start biting. When they start biting, mother will end up getting small cracks and sores on the nipple. Then she stops feeding. Then again, because of the pain, breast milk production will stop. So this is again proper position and proper latching should be taught to the mother. Better to be told to them earlier, even when they are coming to us antenatally, about the importance of good feeding practices or good method of how to feed, not to sleep and feed. Okay. So if everything is fine, if a good breastfed mother and everything, this is how the baby happy, mother happy, mother's happy, baby's happy, and everybody at house are also happy. So this is like a normal thing. So good feeding is finally the our motto. So yeah, so that's my thing. So finally, a take-home messages. So rule out, and the mother should be taught in antenatal period about how to breastfeed. What is the importance of breastfeeding? Any of the retracted nipple or any problem should be treated earlier, and definitely you will have a healthy mother and a healthy baby. Thank you.
Thank you, madam. It was indeed an informative and fruitful session. This is the
Thank
time
you.
for queries. Participants, if you have any queries, please put it in your chat box. Participants, please note, if you have any queries, you can put it in the chat box. I hope there are not queries in this chat box. So thank you, madam, for a wonderful session. Thank you, ma'am. So
Thank you.
let us move. Okay, ma'am. So let us move to the next session. Lactation is under endocrine control. The two primary hormones that are needed for lactation are prolactin and oxytocin. The ejection of milk from the lactating mammary gland is controlled by a neuroendocrine reflex mechanism. To highlight on hormonal control on human lactation, we have a renowned personality among us, Sister Danya Devasya. Sister Danya Devasya has completed her UG and PG in nursing from Father Muller College of Nursing, Mangalore. She has 9 years of clinical experience, especially in OBG wards of various hospitals in our country, and 16 years of teaching experience. Sister has done her certificate course in Educational Science and Technology, e-learning training of INC to fight against AIDS, TB, and malaria, virtual training for capacity building of midwifery teachers, and she has completed certified lactation education course. Presently, she is PhD scholar in Nitte University, Derlakete, Mangalore. Sister has the credit of presenting and publishing various papers. She has organized various conferences and had been the resource person in different seminars and conferences. She is a registered member of KNC and TNI, also the institutional ethical committee member of Nitte Usha Institute of Health Sciences. Presently, Sister Danya Devasya is working as Professor and HOD of OBG Nursing, Father Muller College of Nursing, Mangalore. We are eager to hear to you, dear sister. Over to you.
Thank you, Dr. Larissa Mata, the principal, Madam Sandhya and her team for organizing this session and for the opportunity given to me to share my knowledge on hormonal control on human lactation. The theme of this year, Protect Breastfeeding, a shared responsibility, invites us to consider breastfeeding as an issue of not only of the mother, but also of every healthcare personnel of a particular setting. Proper knowledge of the hormonal control on human milk production and excretion should motivate us to initiate breastfeeding soon after birth, to encourage frequent breastfeeding and proper emptying of the breast, to support, create, and enable an environment which enhance breastfeeding. So, I am here to share my little knowledge on hormonal control on human lactation. Is it visible? So there are many hormones and receptors responsible for the milk production, secretion, continuation, and maintenance of lactation. As you know, the process of milk production essentially requires mammary gland development. It's called as mammogenesis. The ability of mammary glands to secrete milk, lactogenesis, and finally, milk production, lactation. The commencement of lactation depends on the separation of the placenta and the suckling of infant. So, what is lactogenic hormones? Hormones that stimulate the growth of the mammary gland and lactation after delivery are called as lactogenic hormones. So these lactogenic hormones can be divided as hormones directly responsible and hormones indirectly responsible. The hormones directly responsible are prolactin and oxytocin, whereas indirectly responsible hormones are estrogen, progesterone, cortisol, that is glucocorticoid, placental lactogen, growth hormone, thyroid stimulating hormone, and prolactin inhibiting factor. So, mammary gland undergoes changes in size and appearance during pregnancy. You know, the estrogen causes growth of the mammary gland ductal tissue, and progesterone causes the growth of lobes, lobules, alveolar development, and maturation of the epithelium. So, these are the progesterone's work, and this ductal system will be growing due to the hormone estrogen. So the ductal sprouting and branching and lobular formation is also regulated by placental lactogen, prolactin, and chorionic gonadotropin hormone. So between 16 to 24 weeks of pregnancy, a woman's breast begins the secretory stage and colostrum is produced and can be expressed. High level of progesterone during pregnancy prevents the production of milk. We said 16 to 24 weeks milk is produced, but because of the hormone progesterone, milk production is prevented. So now we shall see the hormones directly responsible for lactation. The first hormone I will be presenting to you is prolactin. Prolactin secreted by the anterior pituitary gland. It increases steadily up to 10 to 20 ng per ml from the non-pregnancy plasma level to a peak of 200 to 40 ng per ml at term gestation. This acceleration stimulates the maturation and proliferation of lactiferous ducts and alveoli. So soon after delivery, the plasma level of progesterone and estrogen drops abruptly. As a result, the anterior pituitary gland continues to produce prolactin. It increases 7 to 20 times higher prolactin in 24 hours and a greater amount during sleep. So a steady increase of prolactin is also observed when the baby suckles the breast, and it contributes to the production of milk. That is why we stress on immediate initiation of breastfeeding. It reaches its peak 30 to 45 minutes after the beginning of breastfeeding, so makes milk available for the next feed. During the initial days, the more the nipples are stimulated and baby suckles, more prolactin and more milk are produced. Milk secretion, which was endocrine, will be shifted to autocrine after the second stage of lactogenesis, that is about 96 hours after delivery. So soon after delivery, initiation is important and it causes prolactin production. So after the establishment of lactopoiesis, that is maintenance of the established milk production, removal of milk is mandatory for the hypothalamus to continue lactation. So whenever baby suckles, Whenever baby suckles, nipples are stimulated or removal of milk takes place, there will be inhibition of the release of prolactin inhibiting factor, that is dopamine, by the hypothalamus. This in turn enhances the release of prolactin and increased milk production. After the first week, there is a 50% decrease in the level of prolactin. If a mother does not breastfeed, it may come to a non pregnant level within 7 days. Both the breast excrete an equal amount of prolactin. Its level declines but is detectable in mature milk up to 40 weeks. That means up to 40 weeks prolactin will be present, but its level continues to increase for 1 week. Then later on it comes down, but prolactin will be present. To keep the prolactin present in the mother's body, we need to allow the baby to suckle more. So there are two local milk volume control mechanisms. One is feedback inhibitor of lactation, FIL, and is present in the milk itself, which inhibits milk production and is associated with the residual milk in the breast. That means if the breast is not emptied, further production won't take place. Secondly, the stretching of alveoli also affect the secretion of milk locally. So prolactin levels are higher at night. So breastfeeding at night is helpful to establish a good supply of milk. Again, prolactin relaxes and induces sleep in the mother, so she can rest well even after night feeds. Level declines slowly during lactation and level increases with suckling. The more feeding, the more emptying of the breast, more milk is produced. More than 8 breastfeeding per day prevents the decrease of prolactin level before the next breastfeeding. Prolactins present in the blood delays the commencement of ovulation by inhibiting the ovarian response to FSH, LH, and gonadotropin hormone. As a result, ovulation and menstruations are delayed, and next pregnancy will not take place soon. So, prolactin level is higher in breastfeeding mothers with amenorrhea than in mothers who are menstruating during the first year postpartum. This is the mechanism because of the presence of FSH, LH, and gonadotropin. Prolactin level is decreased with the smoking, and prolactin level rises with anxiety and psychological stress. There is no relationship to postpartum engorgement. So here I would like to summarize the response or hormone prolactin's work. Enhancing factors are early initiation of breastfeeding, good attachment and effective sucking, frequent feeds including night feed, and emptying of the breast. So this has to take place for the production of prolactin, which is necessary for good production of milk. What are the hindering factors? Delay in initiation of breastfeeding, prelateral feed so that the baby will not suck very well, bottle feeding, incorrect positioning, as well as painful breast. Okay, so what is the next hormone? That is oxytocin. It is produced by the neurosecretory cells of the posterior pituitary gland, and it takes the lead in the continuation of initiation, lactation. Its production is quicker than prolactin and enables a steady flow of milk, makes milk available for the baby while sucking. Sucking causes the contraction of the myoepithelial cells around the alveoli. This contraction is termed as let down or milk ejection reflex. So letdown reflex causes the mother to experience warmth, tingling sensation, fullness, and pressure in the breast during milk ejection. So the oxytocin level rises within 1 minute of the baby suckling or nipple stimulation, and it may remain elevated and is possible to return to normal within 6 minutes after stimulation. So continuous flow of milk takes place. So this is the summary of milk ejection reflex. It is hypothalamus is stimulated because of the suckling and the sensory input to the hypothalamus. It stimulates both posterior and anterior pituitary. Posterior pituitary will produce oxytocin, causes milk ejection or excretion, and anterior pituitary stimulation causes the production of prolactin and production of milk takes place. So what are the evidences we see regarding this? So why do we get fully through the research we have found out these things enhances the production, or certain things enhances the production of prolactin as well as oxytocin. So letdown can occur even a mother just thinks of her baby, wanting to breastfeed, feeling the smell of baby, caressing, looking at the newborn, affectionate thought, listening to baby's cry and sound. So letdown becomes slow when a mother is lacking support, especially mother's or husband's presence. That is why divorced women will not have much milk production. Emotionally upset, stressed, and in pain. So increased thirst reported by first-time mothers while breastfeeding is because of this. Again, calmness experienced by the breastfeeding mothers too is governed by oxytocin. Oxytocin relaxes the mother because of the property to decrease the body's response to stresses and pain. Decreased plasma adrenocorticotropic hormone, glucose and norepinephrine were observed in the lactating woman during exposure to stress than non-lactating woman. So what are the signs of active letdown? The mother experiences tingling sensation before and during feed. Flow of milk at the thought of baby. The flow of milk from the other breast when the baby suckles one breast. Letdown continues even when the baby is removed for a while, maybe to burp the baby. Baby sucks deeply and rhythmic swallowing. It shows that the baby is getting enough milk. Pain in the uterus and flow of blood because the uterus is contracting. Thirst during feeding. So this is a real sign that there is real letdown, and that can be observed in the baby too. The baby will be passing good number of times urine as well as stool. Okay. So this is regarding the hormones which are directly responsible, prolactin and oxytocin. Remember, prolactin is for production, oxytocin is for excretion, ejection reflex. We go to the hormones indirectly responsible. The hormones indirectly responsible, we speak about estrogen. It is responsible for the development and branching of the ductal system. So this is the duct. So you can see as a result of estrogen, it's branching out. So more ducts will be developed, and high level of estrogen inhibit lactation. So I said prolactin will be producing continuously, but production of milk is not continued because of the presence of estrogen and progesterone. Its level drops soon after delivery and remains low for the first several months. Birth control pills with estrogen are avoided for breastfeeding mothers as they can reduce the milk supply. The next hormone is progesterone. It increases the size of alveoli and lobes. You can see the number of lobes increased here. Additional growth of breast lobules and secretory characteristic of the cells are increased. A high level of progesterone inhibit lactation before birth, and a drop in level soon after parturition triggers lactation. So lactation is delayed in the case of retained placenta. Again, development of the tubule tubules as well as alveoli, causing the alveolar cells to proliferate, enlarge, and become secretory in nature, and causes the breast to swell, and the plasma progesterone level drops tenfold during the first 4 days after parturition. Next hormone is cortisol or glucocorticoid. Cortisol, the glucocorticoid, act on the mammary gland in collaboration with the prolactin. It is responsible for the exchange of water across the cell membrane during breastfeeding. So initiation of, that is why mother is feeling more thirst too. So the initiation of milk synthesis requires insulin-induced cell division and the presence of cortisol. Cortisol is needed for the complete development of the alveolar epithelial cells to secretory milk cells and the initiation of milk secretion. Glucocorticoid receptors are found to increase towards the end of pregnancy for this mechanism. The next is placental lactogen. It is a placental protein responsible for the alveolar growth of the mammary glands. Its presence in the blood is seen from the second month of pregnancy. By the second trimester, it can stimulate the secretion of colostrum. In combination with the prolactin and breast receptors, it contributes to the enhanced growth of nipples and areola before delivery. Its level comes down soon after delivery, and this in turn enhances the action of prolactin. Next is growth hormone. Structurally, it is similar to hormone prolactin, and it helps for the maintenance of lactation, that is lactopoiesis. Next, thyroid stimulating hormone TSH. It enhances mammary growth and lactation. It stimulates the release of prolactin. It plays an important role in galactopoiesis. An increased plasma TSH are noticed on the 3rd to 5th postpartum days. Next, prolactin inhibiting factor, PIF. So, which is the prolactin inhibiting factor? Dopamine. So, it negatively controls the production of prolactin. Some of the dopamine agonists suppresses lactation. As a result, prescribed as a drug to stop the production of milk, especially bromocriptine. And dopamine antagonists are prescribed for enhancing milk production. About this, I will discuss later. So now, these are the 7 hormones which are indirectly responsible. So together with the prolactin and oxytocin, these hormones causes a good production of milk and as well as excretion of milk. We also use at times synthetic hormones. So 2 words regarding this. Hormones or substances using for inducing, maintaining or increasing milk production or lactation are called as galactagogues. We see most of the time we use this because we have failed to initiate breastfeeding soon after delivery because of certain events. Maybe the patient might have been in ICU because there was some complication, or we may have to give some kind of drugs which prevents this production, and the baby might have been shifted to NICU. So these cases, we may have to prescribe certain galactagogues. But the best galactagogues are baby suckling in correct position, confidence, which we have to give during the antenatal period itself, courage, knowledge of mother, support of significant family members, especially the mothers, correction of biological causes such as nipple issues, flat nipple, inverted nipple, okay, etc. So which are the synthetic hormones we are prescribing? One is metoclopramide. It's also called as perinone. So it has proved to increase milk supply. It is considered as safe because of the minimal transference to babies through breast milk. but is not advised to continue for more than 12 weeks due to the side effect. We know sometimes a lot of side effect takes place, but you don't even prescribe for 2 weeks. You will only prescribe for maybe maximum for 3 days or 4 days. By the time the baby starts sucking, and that sucking itself will produce good milk. The next is domperidone. It is also considered as safe. Despite its labeling as a safe drug by FDA, it is not approved by Food and Drug Administration due to less number of research studies. It can cause adverse effect in patients with prior liver diseases, cancer, and GI bleeding. So this also is not given for many days. Maximum we may give for 1 or 2 days. The next is chlorpromazine. It is also trade name called as Largactil. It is an antipsychotic medication, rarely used as galactagogues in extreme cases. Because it can cause drowsiness, lethargy in infants, and can cause psychotic symptoms such as paranoid reaction in mother. So we don't prescribe. In olden time, when we were using the cocktail regime, chlorpromazine was considered was one of the drug. And we have observed patients who had been receiving this chlorpromazine as a cocktail regime used to have good milk production, even though we could not initiate immediately the breastfeeding. The next is oxytocin. It is safely prescribed when ejection reflex is delayed, which is seen in stress and premature birth. We said stress can enhance the production of prolactin. Research already proved when there is stress, when there is lack of support, mother is too much anxious, production of prolactin is more, but oxytocin is delayed. So in that case, production of milk will be there, but the mother is not able to let down. So in that case, we will be giving oxytocin. It is considered as safe, but high dose can cause uterine cramping. Usually it happens in the first days. So during the time involution takes place, mother complains of more pain. So cramping of the uterus because strong uterine contraction. Adverse effects are very less. So it is a safe drug. The next is medroxyprogesterone. We don't use it as really galactagogue, but we have found that the increased production of milk was reported in non-pregnant, non-lactating women using depot medroxyprogesterone that as a contraceptive. So even though they were not lactating, some of them came with the complaints that there is production of milk or milk can be expressed from the breast feather. So other synthetic galactagogues includes antipsychotic sulpiride as well as risperidone. Okay. So in exceptional cases wherein one want to induce lactation without pregnancy, risperidone is and metoclopramide is preferred. So that may be in certain cases. So here I would like to summarize the entire thing what I have told. So proper lactation includes or it needs homogenesis, lactogenesis, galactopoiesis as well as galactokinesis. Mamogenesis, that means there is ductal system is improved, lobular as well as alveolar system is improved. So for the ductal system development, estrogen, adrenal steroids as well as growth hormones are necessary, whereas lobulo-alveolar system, progesterone, estrogen, prolactin, adrenal steroids, growth hormones are necessary. So galactogenesis depends upon withdrawal of estrogen and progesterone. So a fully developed mammary gland will respond well with the prolactin, thyroid as well as TSH and glucocorticoid, growth hormone and insulin, and then that and also with the help of withdrawal of estrogen and progesterone, prolactin production is increased, galactogenesis takes place. Galactopoiesis is mainly dependent upon the suckling of the baby and also the prolactin, and then galactokinesis, it becomes autocrine, endocrine become autocrine if mother establishes a regular or teach the art of breastfeeding. Baby has to learn this art of breastfeeding. Baby knows to suck, so that the sucking has to be stimulated immediately after delivery, and also the baby should learn that only through sucking I get the milk. Only when they get hunger pangs, the baby cry. So baby is not aware that I have to suck and take the milk. So if we have fed the baby with bottle feeding or spoon feeding or palada feeding, baby think that without its effort it will get milk. So it will still go on or wait for it or cry. So the baby has to learn that it has to suck in order to get the milk. So the first 2 days it is difficult, literally difficult for the mother. So if we give proper support for the mother as well as if knowledge and mother baby is initiated soon after delivery, then we can avoid to a certain extent these breastfeeding difficulties, and there will be good production of milk. Mother also will enjoy the motherhood as well as breastfeeding, and we can also contribute a good healthy child to the society. So here I would like to summarize again with the video. You can wait for it when I share.
If you're off fill. Prolactin, a hormone secreted by the anterior pituitary gland. Oxytocin, a hormone secreted by the posterior pituitary gland. Feedback inhibitor of lactation, a locally produced whey protein in the breast, prefers to be called FIL. Progesterone, this hormone is produced in the placenta. Estrogen, also produced in the placenta. Human placental lactogen, produced in the placenta. Don't forget insulin and cortisol. They support hormones required for milk synthesis. Pregnancy. Estrogen and progesterone are responsible for the development of the duct system. Here we see prolactin transforming the mammary epithelial cells into lactocytes. From 12 weeks, there is a colostrum-like secretion in the lactocytes, and from the second trimester, colostrum is present. This is defined as lactogenesis 1. If the presence of high concentrations of prolactin stimulates milk production, why does the breast not produce copious amounts of milk in pregnancy? Progesterone suppresses the target cell response to prolactin. So, in the presence of progesterone, milk production is suppressed. Estrogen is also a prolactin antagonist. HPL occupies the lactogenic receptors in late pregnancy. Birth to 48 hours. With the birth of the baby in placenta comes a significant change in hormone levels. The most influential is the rapid fall of progesterone to baseline by 48 hours, which liberates prolactin. Prolactin, in the presence of insulin and cortisol, is now able to influence the secretory activity of the lactocytes, and milk production begins. Milk production slowly increases from around 30 hours until 48 to 72 hours. Women become aware of an increase in milk supply, described as the milk coming in. HPL levels fall within hours, while estrogen levels fall to baseline by day 5. If no breast stimulation occurs, prolactin levels begin to fall and are basal by day 14. During a feed. During a breastfeed, nipple stimulation, either by the infant feeding or manual expression, causes the anterior pituitary gland to increase prolactin secretion and the posterior pituitary gland to release oxytocin. An increase in prolactin stimulates an increase in milk secretion in the breast. The oxytocin response to nipple stimulation has a local effect on the myoepithelial cells of the breast, causing them to contract and eject milk down the ducts and out through the nipple. The oxytocin release is pulsatile in nature, with each surge lasting 20 to 60 seconds, with multiple surges each feed. Prolactin levels begin to fall 30 minutes after the feed has been completed. So, given that we know that prolactin levels remain elevated even between feeds, why doesn't the breast keep continuing to produce milk at a constant rate? Do you remember Phil, the feedback inhibitor of lactation? Phil is a whey protein that exerts a concentration-dependent autocrine inhibition on milk secretion. When milk storage levels become high, Phil concentrations are also high. This triggers a downregulation of milk production and protects the breast from continuing to overfill. Week 2. Over time, the local mechanisms in the breast regulate milk supply. These are dependent on regular milk removal for day-to-day regulation. This is known as supply and demand. The baby is becoming more efficient at milk removal, and the breasts are no longer overfilled, unless the baby sleeps unusually long periods or a feed is missed. Prolactin remains important, but baseline levels decrease over time. It's the surges of prolactin that occur during feeds, rather than the baseline levels, that influence continued milk production. Oxytocin remains important for effective milk removal throughout lactation. As each feed progresses, Phil decreases and prolactin increases. This re-establishes milk synthesis at an increased rate to replace the depleted stores. Hormonal influences during lactation. Events can occur during lactation that may prompt you to question the hormonal interplay. Consider these two events, the mini pill and pregnancy. This doesn't influence established lactation, as the functional lactating breast has no active progesterone binding sites. While there may be some impact on supply early in the pregnancy, the supply-demand or autocrine control maintains the supply. Suppression of lactation. When the regular removal of milk ceases, the hormonal feedback to the brain also ceases, resulting in a downregulation of milk production. Along with the influence of Phil on the undrained breast, milk production reduces and finally ceases. In the absence of prolactin, progesterone and estrogen re-engage their influence, and the menstrual cycle begins again. The length of time women remain amenorrheic due to lactation is varied, with some women recommencing the menstrual cycle while lactation continues.
So in conclusion, the normal physiology of lactation is a process that begins to take effect well before the initial latch of the newborn infant. It requires the breast to change in composition, size, and shape during each stage of female development. Lactation is also maintained by regular removal of milk and stimulation of the nipple by the baby. Thank you.
Thank you, sister, for an excellent and informative session. And of course, the video was very informative and interesting to watch. This is the time for queries. Participants, kindly upload your queries in the chat box. I hope there are no queries from the delegates. So, sister, thank you so much for this
Thank
session.
you. Thank you.
Before winding up today's program, I would like to extend my gratitude to our resource persons, Dr. Sharon Dipti Rasquina and Sister Danya Devasya, from the bottom of my heart, not only for being present and sparing their valuable time, but also for giving us interesting sessions and filling us with the knowledge. We will cultivate the knowledge you gave us in real life. My sincere thanks to principal, faculty, and all the delegates for making this day a fruitful one. Once again, I thank you all for being with us in this afternoon and have a wonderful day ahead. And we will meet again tomorrow at sharp 2 p.m. Thanks to all. And the feedback link will be uploaded tomorrow in the chat box during the sessions.